Hi everyone, I'm Dr. Kajal. Welcome back to my channel. Our today's topic is maxilla. In our previous video, we have covered mandible, anatomy of the mandible, osteology, or anatomy of the mandible. In this video, we will cover the anatomy of the maxilla. So, the discrete portion of our face is known as the maxillary bone. Same as the mandible, it has body portion and four processes, four surfaces we will discuss in detail in this video. First of all, the introduction. It is the second largest bone of the face after the mandible. So we all know the mandible is the largest bone. The two maxilla forms the whole of the upper jaw. Same as the mandible, we have maxilla. These have two processes like this. These are the one and this one. Okay, right and left maxilla which joins together to form a whole maxillary bone. We have these processes, okay, frontal process or the zygomatic process or the alveolar process and the zygomatic process that or the palatine process. We will discuss in this video in detail. We will continue stepwise according to the surfaces. Then we study about the processes of the maxilla. This diagram is referred from your BD Chaurasia. We will read about this frontal process, anterior lacrimal crest, infraorbital margin, infraorbital foramen, anterior nasal spine, nasalis muscle which is attached to this portion. All of this we will learn is this in this video. Now, first of all, we are learning about the body of the maxilla. The body of the maxilla is pyramidal in shape, base is directed towards the nasal surface, and apex is directed towards the zygomatic process. Okay, now this is the body of the maxilla. I have earlier told you that it is triangular in shape. You can clearly see this triangular in shape. This is the base of the triangle, and this is the apex of the triangle. Okay, so the base of the triangle is facing towards the nasal side and the apex is towards the zygomatic side. So the apex is directly related to the zygomatic process. Okay. There are four surfaces of the body of the maxilla. I hope this is clear to you. Now the surfaces of the maxilla. These are the four surfaces. Anterior surface, then we have superior surface, then we have this posterior surface and a mesial surface. Mesial surface is towards the nose. This is mesial surface. This is anterior surface. This is superior or orbital surface. Okay. Now we start with the anterior surface. Anterior surface, it is directed laterally. Okay, directed laterally. You can clearly see this. It is directly laterally, and this is all of this area is known as the anterior surface. Now, our first landmark is incisive fossa, a shallow bony depression located at the anterior facial surface of maxilla. Okay, here we have this area is known as the incisive fossa. We already studied in the mandible, but this fossa or foramen, a depression in the bone is known as the fossa, and this is the incisive fossa. Just above the incisor, you can clearly see here a depression in a bone. See here the depression in the bone. This is known as the incisive fossa. Now we have canine fossa. Just literally, canine fossa is located laterally to the canine eminence. This is the canine eminence. Okay. Now canine fossa. Canine fossa is located over here. A depression in the bone. This is the canine fossa. Then we have infraorbital foramen. This is this is infraorbital foramen. Okay. Infraorbital foramen is above the canine fossa, which transmits the infraorbital nerve and vessels. Okay, it is above the canine fossa, infraorbital foramen. Now, the one more important thing, levator labii superioris arise between the infraorbital margin and the infraorbital foramen. Okay, now infraorbital foramen is this. This is the infraorbital margin. Okay, this is a infraorbital fossa, and the levator labii superioris arise between them. This is from this area between the infraorbital margin and between the infraorbital fossa foramen. Okay. Then we have the next landmark, that is nasal notch or the incisura nasalis. ठीक है? Refers to the curved concave border of the maxilla or the rough margin of the frontal bone. This area, this area is or the surface or the rough surface on the frontal process. ठीक है? We will discuss the processes later on. Then we have anterior nasal spine. It is a pointed bony projection formed by the fusion of two maxillary bones. This is our posterior surface of the maxilla. Now the posterior surface is concave and directed backward and laterally. It forms the anterior wall of the infratemporal fossa. Okay? Now this portion, this portion, this portion of the maxilla, okay, on the each side, this forms the anterior wall of the infratemporal fossa. And then we have maxillary tuberosity, which holds the maxillary molars. Okay, this is the infraorbital groove. Okay, above the smooth surface, which forms the boundary for the pterygopalatine fossa, is grooved for the maxillary nerve. Okay. So with the posterior surface, it is a concave and directed backward and laterally. It forms the anterior wall of the infratemporal fossa in here, separated from the anterior surface of the zygomatic process, and a rounded ridge which forms the maxillary tuberosity and holds the maxillary molars. Then we have infraorbital groove. Then we move to the next part. Our next surface is orbital surface. See, we have covered anterior surface. This is the posterior surface. Then we have this superior surface or the orbital surface. Okay, superior surface is smooth, triangular and slightly concave and forms the greater part of the floor of the orbit. ठीक है, it forms the greater part of the floor of the orbit. Smooth होता है, slightly concave है. Then anterior border of the superior surface forms a part of infraorbital margin, medially continue with the lacrimal crest of the frontal process. We can clearly see here, it forms the inferior orbital ridge anteriorly and posteriorly also. And then we have with the frontal process. Okay. Then the posterior surface. The posterior border is smooth, but it is notched by the infraorbital groove. Here is the infraorbital groove. We can clearly see this infraorbital groove. It is a smooth surface. Posterior surface is smooth but notched by the infraorbital groove. Medial border is present with the lacrimal notch. Okay. Medial border. Medial border is this, and it is here. We have frontal process. Okay. Then this is the orbital surface. Then we have this zygomatic process. This is the orbital surface or the superior surface of the maxilla. Then here is a mesial surface. It is the upper posterior part of the part. There is a large maxillary hiatus which leads to the into the maxillary sinus. Okay, articulate with the skull. Behind there is a rough surface or impression for the perpendicular plate of the. This is our mesial surface. This is our mesial surface of the maxilla. This is the mesial surface. Okay, mesial aspect of the disarticulated left maxilla. Articulated maxilla and disarticulated. Articulated maxilla we will discuss in further videos. Firstly, we can see this simple disarticulated left maxilla. Now we can clearly see here mesial surface. It is the upper posterior part. There is a large maxillary hiatus which leads to the maxillary sinus. Okay, it articulates with the skull. This height is completely by the ethmoidal and the lacrimal bone. Behind this, there is a rough impression for the perpendicular plate of the palatine bone. Okay, for the palatine bone. This is the perpendicular plate of the perpendicular. This see, this is the perpendicular plate of the palatine bone. In front, the maxillary hiatus, there is a lacrimal groove, more anterior canal, crest or articulate with the inferior nasal conchae. It articulates with the anterior nasal spine of the palatine fossa. This is palatine fossa of the maxilla. Okay, this is the hiatus, inferior hiatus. Mainly in the mesial surface, we will discuss about the hiatus, which leads to the maxillary sinus and the perpendicular plate of the palatine bone. There is a nasolacrimal groove here, over here. Then this is all about our four surfaces of the maxilla, of the maxillary bone. Now we get back to our presentation. See, this is the articulated one, where it articulates with the sphenoethmoid process. This is the articulated picture of the mesial surface of the maxilla. There are four processes of the maxilla: zygomatic process, frontal process, palatine process, and alveolar process. Now we will discuss in brief about the zygomatic process, frontal process, and the alveolar process and the palatine process. So it is the we can clearly see here it is the frontal process. Now what it covers in the lateral surface. The lateral surface of the frontal process. If we take each frontal process separately, then this portion is machinery separately. Machinery. If we study the each frontal process separately, this is the mesial portion, this is the mesial portion, or this is the lateral portion. Now we will discuss about the lateral surface. Vertical ridge of lacrimal crest. Here is the vertical ridge for the lacrimal crest and the groove for the lacrimal sac. Here we have lacrimal sac. Okay. Then next is medial surface. Okay, medial surface, you can see the nasal cavity. So it is a rough, uneven, and articulates with the ethmoidal and also closes with the anterior ethmoidal sinus below the ethmoidal crust. Okay, on the mesial surface, ethmoidal crust. This surface articulates with the ethmoidal bone. Okay, then the upper articulates with the frontal bone. Here we have a frontal bone. Then posterior bottle is lacrimal bone. In the posterior, it is a 2D diagram. On the back side, it has a lacrimal bone. And here we have a lacrimal groove. In above we have frontal bone. In between we have ethmoidal sinus. Okay, this is the frontal process. Then we have the zygomatic process of the maxilla. It is also so easy. Basically, this red portion is the zygomatic process, pyramidal lateral projection on which the anterior, posterior, and the superior surface of the maxilla converges. Okay, anterior, superior, posterior, and the anterior, posterior, and superior surface converges on the maxillary process or zygomatic process. Okay, then we have alveolar process. In this diagram, only we can read about the alveolar process. This is the alveolar process. It has thick arched border behind and contains the socket for the root of the teeth. Okay. See, this portion of the bone is known as alveolar process, and it holds the maxillary tooth. Then we have a palatine process. In this diagram, this is a skull overview, and this is our maxilla. You can clearly see this. This is the frontal process. This is the zygomatic process. This is the body of the maxilla. This is the alveolar process. Okay, this is the maxilla. Okay, now we have palatine process. We have already read about the three processes. That is, the one is the frontal process. This one which articulate with the frontal bone. Okay, one is zygomatic process. This process is known as the zygomatic process on the either side. Okay, then we have a alveolar process. This is the alveolar process which hold the maxillary tooth. Then we have a palatine process which is not visible in this skull portion, but when we this is the sagittal section. We can clearly see here there is a palatine bone of the maxilla or the palatine process. See, palatine process of the maxilla. So the feature of the palatine process of the maxilla, first of all, it is a thick, strong, and horizontal plate. Okay, inferior surface inferior surface concave present numerous foramina for the passage of the nutrient vessels contain the lodgement of the glands, grooves for the greater palatine vessels and nerves. Incisive fossa leads to the incisive canal. See, here is an incisive fossa which leads to the incisive canal. In the posterior portion, it have in the posterior portion forms the floor of the nasal cavity. ठीक है? From the upper surface, it forms the floor of the nasal cavity. We can clearly see this. It forms the floor of the nasal cavity superiorly and later bordered with the crest of the bone. Posterior border fuses with the horizontal plate of the palate. Okay? यहाँ पे हॉरिजॉन्टल प्लेट के साथ फ्यूज कर जाता है. दो हमारे पास पैलेटाइन प्रोसेस होती है, दो हमारे पास जाइगोमेटिक प्रोसेस होती है, दो हमारे पास फ्रंटल प्रोसेस होती है, एल्वुलर प्रोसेस सिंगल होती है. ओके, I hope this is clear about the incisive fossa in the palatine process. This is the palatine process. This was all about the processes of the four processes of the maxilla. Okay, in this diagram, see there is a this is zygomatic process. Okay, on either side. This is frontal process. Okay, this is alveolar process. And in the sagittal section, we can see the palatine process or inside the mouth. Okay, which forms the base of the nasal cavity. Now we have discussed all the features of the processes and all the surfaces of the maxilla, body of the maxilla, processes of the maxilla, surfaces of the maxilla. Now it comes to the ossification. The maxilla ossify entirely intramembranous ossification begins in the 6th to 8th week of the fetal development. Bone formation begins in the mesenchyme of the maxillary prominence, eventually spreading to the multiple directions, palate, or this will you will learn in the embryo also, and the primary centers in the intrauterine life, mesenchymal maxillary process. Okay, it starts in the 7th to 8th week. Then directional speed, palatal ossification कब होती है, postnatal growth कब होती है, postnatally the maxilla continue to grow through surface remodeling and bone deposition at the sutures connecting it to the cranial base, resulting in the downward and forward displacement. Okay. Now we have age changes, just like the mandible. We have also age changes in the maxilla. A maxilla undergoes significant age-related changes, transitional, transitionally. Okay, just like the mandible, we have age changes in the maxilla. Also, it progression. The progression of the maxilla changes varies distinctively by the developmental stages, like in the childhood एंड एडोलिसेंट ग्रोथ फेज होता है. ठीक है, रैपिड फर्स्ट ऑफ ऑल फ्रॉम द चाइल्डहुड टू एडोलिसेंस ग्रोथ फेज होता है. रैपिडली एक्सपेंशन होती है एज 1 to 12 में. ठीक है, द मैक्सिलरी थ्रू grows through the remodeling and structure apposition. This remodeling structural apposition we all discuss in the ortho. Okay, But you have to remember this processes. We will discuss further in another videos of ortho when we cover the growth pattern of the maxilla or the mandible. I have all earlier told you. Then it completed around the age of 8. Now maturation, second early adulthood, then feature alterations क्या क्या होती है मैक्सिला में अर्ली ईयर्स में जब इडेंचुलस फेज आता है तब क्या रिजॉर्प्शन होती है एंड ऑल then this is the end of our slides. Now this is a short or descriptive video I have tried to make about the maxilla, in which we have discusses all the four processes of the maxilla, surfaces of the maxilla, and attachments which are important from the exam point of view. Okay, so this is the end of our video. I hope you all do this picture. So thanks for watching. I hope you found this video helpful. If you enjoyed it, please like, comment, and subscribe for more videos like this. Check out my next video on the screen, and I will see you in the next video.